Next, we're going to be discussing the decubitus images that we'll be taking for a double contrast, air contrast exam of the colon. I will just be demonstrating one of the decubes, but both the right and the left decubitus must be taken during the exam. For decubitus images, we must include both sides and then again from the rectum up to the flexure. So we have to take films that will cover that entire area. Because the patient will be lying on their side, we also need to build them up from the edge of the table and the tabletop. So you must be using a blue decubitus sponge to help raise the person up. So I'm going to be asking my patient now to roll up onto the right side. I'll do a right decubitus. I'm going to take the sponge, place this underneath her hip. Bend both of the knees. Make sure your patient's in a true lateral, both arms up. I'm just going to pull her forward a little bit so that I have room to place my phone behind. Okay, so once your patient is lying on top of the decubitus sponge, making sure again that we're including from diaphragm down to the rectal sigmoid area, make sure that you also have enough space behind your patient to place your film. Make sure the arms are up, and again, we have a nice lateral position. To place the film, we're going to place it behind her. I'm going to bring my tube over and do an AP projection. When you are doing decubitus images, we want to use the decube holder, and you want to make sure to place a grid on your film because of the scatter. I'm going to take my right marker, place it down at the bottom of the film, and place it behind her. I'm going to center at the top of the iliac crest, place the middle of my film there. Notice again the film is lengthwise with her body. I'm looking at the bottom of my film to make sure I'm at the greater trochanter area so that I have the rectal sigmoid area. Top of the cassette close to the armpit to make sure that both flexures are included. When you're doing decubitus films, the tube may be on either side of the table. Going to measure your SID to 40 inches. And then we're going to center where we centered our cassette. So the top of it is going to be at the top of the iliac crest. And then we want to be centered at the MSP, so down the xiphoid area. Collimate so that you're including top to bottom with your 14 by 17 size cassette. And that would be your right lateral decubitus. The right lateral decubitus is going to be the best view to demonstrate the left side because the air will rise up. So it will demonstrate the lateral border of the descending colon the best, but the medial border of the we are demonstrating the medial border of the ascending colon down here on the right. These views are very good to demonstrate polyps and again looking at the mucosal lining of the colon, including again from rectal sigmoid all the way up through the flexures, and to make sure you're doing the image also again on expiration.